But I'm joined in studio by Dr. Eithne Lowe, who joins me, and Cedric Malloy joins me as well, and Dr. Marlon Glenville joins me on the line as well, because we're looking, Cedric, you're looking at a very special event on Monday next, taking place in the Galmont Hotel.
Yeah, we're running an event discussing nutritional and medical ways to improve your fertility. So this is for people who are either planning a pregnancy or would like to reduce risk of miscarriage and learn about medical nutritional ways to improve their chances of conceiving and improve success rates with IVF and to go on and have a healthy pregnancy.
Dr. Lowe, good morning to you as well. Thanks for joining us. Dr. Glanville, good morning to you as well.
Yes, good morning, Keith.
I'm surrounded by doctors today, so I am, between musicians and doctors, so yeah. And again, this is, yourself and Dr. Lowe are going to be present, Marlon, so you're at this event. Are all any two couples the same, or are you dealing with something different every time?
Yes, we are, and I think it's wonderful that Dr. Lowe and both of us can talk about both the medical side and the nutritional side together. And couples, male and female, they'll be on a different fertility journey, different stages. Some may only have started trying, others may find it's taken them longer, or they've got a history of recurrent miscarriages, and they're just thinking of what to do now, what next steps they should take. So having this integrated approach with both of us speaking, I think is wonderful to give men and women the information they need to make those informed decisions about what steps they should take next.
Dr. Lowe, morning to you as well. Thanks for joining us. Just because people are getting married later in life now, do you see people presenting for fertility assistance later in life then?
I think that's really true. I mean, I meet women and the commonest thing they'll say to me is, I've spent the last 15 years trying not to get pregnant, and now I want a baby. First of all, I don't know what I should be doing, and secondly, it just isn't happening. You know, most of us know we should be taking folic acid, but after that, they don't really have any specific things that they know they should be doing. And women don't come to me wanting one baby, because they really feel that nowadays two babies is a family. Obviously years ago it used to be a great many more than that, but so if you delay by a few years by trying for your first pregnancy, then the second pregnancy is that bit harder. And so
is it the second pregnancy is harder after?
Well, if you're 37 when you try for your first baby and you get pregnant at 38 and deliver at 39, you're then by definition going to be 40 or 41 when you start trying for your second baby, and at that stage fertility really has started to decline.
But your job must be difficult at times. It must be joyous, and then it must be very sad at times.
It
joyous
is
when it does and you see the births, and then when it doesn't work it has its downfalls.
Absolutely. It's a very hard journey for couples. It's extremely stressful, and we try and make it as easy as possible. And it's very sad when people come to us and have been trying for 2 years or 3 years and still haven't given up smoking. You know, these things that they should know themselves that are really significant, and that's what we want to bring across at this meeting on Monday night. Is there's an awful lot that couples can do before they get near me, and they might get pregnant naturally without coming near me. You know, it's
and genuine. I'm not a smoker, by the way, but is smoking that difficult?
Oh, absolutely.
It's that hard,
and it's worse than that because it's so addictive. You know, people come in and they say, I know I should give up, but I can't. It reduces IVF success rates by 30%. It increases your risk of miscarriage, and that's before we talk about small babies and, you know, preterm labour, and all the problems actually during the pregnancy. So not only are you reducing your fertility, you're causing problems that, you know, will pass into the next generation. So
really clean living, clean eating, clean everything before.
Yeah, absolutely.
Will make the conception hopefully and the journey easier.
And I suppose the most annoying thing that people find when they come to me is I'm telling them off for over-exercising, because actually doing too much exercise can stop women's periods, or doing too much exercise in men can cause fragmentation and sperm damage. So there is an absolute balance there of, you know, too much one way or too little the other that is relevant.
Well, I don't know really what you're talking common sense to them when they come in.
I hope so.
And but some of it that they should know as well.
Yeah.
Like by giving up smoking, by giving up alcohol, by not overdoing exercise. That's common sense.
It's common sense. And then there's the things that really aren't out there, like the caffeine can increase your risk of miscarriage, you know, and
coffee.
Yeah.
Really?
So you have to limit the amount of caffeine, and it's not just coffee, of course, it's chocolate and Coca-Cola and, you know, all these things that have caffeine in them.
I'm glad we had kids early on in life.
And this is it, you see, because when you're young, your sperm and your egg are stronger, so you have a better chance of coping with any of these minor problems that you're not doing perfectly. Whereas when you get older and the sperm and the egg are weaker, then you have to be much more aware of how the lifestyle factors may have an impact.
Dr. Glenville, do you agree across the board with Dr. Lowe?
Oh, yes, tremendously. All of those different factors. And I'll also be covering how to eat, what foods to include, what to avoid that's going to make a difference in terms of both fertility, both for the man and the woman, and how we can use other vitamins and minerals, not just the folic acid, but we now know that other nutrients, particularly zinc, is important for male fertility, how other nutrients can help women conceive either naturally or improve any success rate for IVF treatments. So it is thinking about the whole lifestyle, the dietary change. Even stress may be a factor for couples along this fertility journey. So this integrated approach of knowing what's available medically, what women and men can do with their lifestyle, really important, because it can make the difference between, conceiving and also having a healthy baby.
And can you really, from a research point of view, Dr. Glenville, can you trace that right back to what they're putting into their systems?
Yes, I think we can, and that's the difficulty. Generations ago, our food was much cleaner, it would have been fresher. Nowadays, there's a lot of use of pesticides, and also it can be travelling thousands of miles before it gets on the supermarket shelf, so there can be a lot of depletion. And of course, we've got chemicals and preservatives and other things in the food that we would have never had before. So the body is having to find it more difficult to manage, and just how we get back to a healthy eating plan and also a healthy lifestyle. Really important when couples are struggling to get pregnant.
And Dr. Lowe, just coming back to you on this one, are there blood tests initially so you can determine what they're low in, or how do you determine what's needed?
Well, that's where the Glenville Nutrition specialise. They can offer all these blood tests. They do they'll tell you more about it, but they do a panel which looks for all those nutrients. So we work as a team together when it comes to nutrition. Yeah. I work more on the lifestyle factors, with the smoking. And
so effectively the screening that they come to you with from the Glenville Clinic, you can then work from that and say, okay, this is the bar we're at.
Yeah.
And then lifestyle. Are you still having 40 fags a day? You can't do that.
Yeah.
Yeah. But then you can help them to get off them.
Yes, exactly. Yeah, so we have to give a lot of support, because there's an illusion out there that the e-cigarettes are safer. So your normal cigarettes will have 1,000 different chemicals in them. At least 40 of them are carcinogenic. But even the e-cigarettes still have carcinogenic chemicals in them. And the trouble is there's no labelling on the e-cigarettes. They're sold as safe and there's no labelling, you've no way of knowing, but there are certain chemicals that can disrupt your thyroid hormone, which is essential for getting pregnant and carrying a healthy pregnancy. So it's very, very difficult, when the correct advice isn't out there for couples.
We had a story, by the way, yesterday, where young people now, 15, 16, are actually crushing Valium, putting it into tobacco, and they're smoking that.
Wow.
So you can imagine what the problems are going to happen in the future.
And the e-cigarettes are a gateway to normal cigarettes. The youngsters are able to get them much more easily, I think, than normal cigarettes nearly. So there's a lot of teenagers are using the e-cigarettes at the moment, so it's difficult.
It is. Sorcha, where can people get tickets for the Galmont Hotel on Monday night, and how much are they?
So, the tickets are €20 for an individual, or €30 for a pair of tickets. A couple may like to come along, or two friends. And if they visit glenvillenutrition.ie, so our website, they'll find the tickets available for sale there on the events page, or also they'll find the tickets on Eventbrite.
Okay, so go to Eventbrite. Can they go on the night, on the day? Will you be selling?
Absolutely, yeah.
Okay, so you're kicking off 6:45?
6:45, and we'll have the two speakers, and we aim to finish up around 9:30.
And Q&A,
in the Galmont Hotel.
Q&A then from there.
Yeah.
Dr. Glenville, so you're coming over especially for this then?
I am, and I'm really looking forward to it. And I
you
think
just love Galway, so you do.
Sorry?
You just love Galway.
I do, actually. Yeah. I do. I think out of all of them, I really do love it, yes. So I just hope it's not raining, that's all I'm saying.
What are you looking for, a miracle, Marilyn? Is it? Yeah, getting that from me this morning, I can tell you. And thanks, Marilyn, for joining, Dr. Marilyn Glenville joining us there. And just finally, fertility, at what stage do you know, Dr. Lowe, that it's not, that rhymes, at what stage do you know that it's not going to work?
That's a very difficult question. What we know is when we meet sub-fertile couples and we do IVF, the success rates drop dramatically once you pass 41. So we tend to start discouraging it at 41, 42, 43. We get the occasional pregnancies, but after that, IVF doesn't work. It's very different when you're meeting a sub-fertile couple as opposed to a woman whose fertility has never been tested. So occasionally women will come to me at 44 and say, I want to try for a pregnancy with donor sperm. they will get pregnant maybe. We don't know what their fertility is, but it's women who have subfertility. You know, there is an age limit beyond which our treatments do not help.
Well, I mean, 44 is...
we should all know that that's a very uncommon age to have pregnancies, but a lot of women don't seem to realise that. They come to me and say, oh, I've just come before it's too late. And I'm thinking, 44, okay.
Yeah.
What can I say?
I'm just thinking of when the kid is 21, the 44-year-old is 65.
And that's a very, that's a social thing as well, isn't it? Our children are much more dependent on us. When we're reading nowadays about 30-year-olds still living at home with their parents, that child will not have somebody supporting them, I'm not judging, don't get me wrong. No, absolutely. We're not either, because we will help those 44-year-olds, as best we can. But it may not be with their own eggs. It may be egg donation at that stage.
All right. If they want to get further details on it, what they can do quite simply is you can go to Glenbin Nutrition if you want to get details on this.